At the ASCO meeting this year, I'll be presenting the minimal residual disease, or MRD, results from the MURANO study. MURANO was a randomized trial comparing venetoclax rituximab with bendamustine rituximab, and a key secondary endpoint was the MRD eradication, but from the peripheral blood, and an exploratory was MRD eradication from the bone marrow. And what we will show is that there's a much higher MRD eradication rate with venetoclax rituximab, so 62% of the patients after 9 months of therapy will have eradicated peripheral blood disease with VR, compared to only 13% with bendamustine rituximab, and that 62% is persistent out to 18 months and continuing for the majority of patients. MRD in the context of CLL is an important endpoint, as it shows that VR is a more effective therapy than chemotherapy in the relapsed setting, and most of the patients had only had one prior therapy. For the first time, we have a relapsed refractory trial where venetoclax is being stopped after a planned period of 2 years. So it's looking optimistic that MRD eradication from the peripheral blood can be used as a surrogate for the bone marrow with this combination. And if you eradicate MRD, this predicts for a longer outcome off treatment when you stop the venetoclax.